Go find a mirror right now, or flip your phone camera to face you. Stick your tongue out and actually look at it. Not a quick glance, a proper look at the color, the surface, the edges, and the coating. Most people haven't done this in years. Here are 8 things you're looking for, and what each one means if you find it. Here's why the tongue is worth checking. It's the only place in your entire body where you can see actual tissue without any skin covering it. Everything else is under a layer of skin. The tongue is exposed, which means changes in your blood supply, your nerve function, your immune response, your hydration, all of it shows up directly on the surface in a way that's visible if you know what you're looking at. Doctors trained in clinical examination use tongue findings as part of a physical assessment. Traditional medicine systems have done it for centuries, but at a standard primary care appointment in 2026, nobody is looking at your tongue unless you have a sore throat. 8 things they would be checking for if they did. One thing before the list. If you notice a sore, a lump, a patch that's been there for more than 2 weeks and isn't resolving, or any area that bleeds without being touched that's separate from everything on this list and needs a dentist or doctor to look at promptly. Everything in the 8 signs below is about color, texture, coating, edge shape, and movement, not about sores or growths. Different categories, different urgency. Sign 1. A pale or very white tongue, not a coating, the tongue itself. The healthy tongue is pink, supplied by a dense network of small blood vessels right beneath the surface. A tongue that looks pale, washed out, or noticeably lighter than it should be, where the tissue itself has lost its color rather than being covered by something, is one of the earliest visible signs of anemia. When your red blood cell count drops, or when your iron or B12 levels fall, the rich blood supply that gives the tongue its pink color reduces first in the extremities and in highly vascular tissue like the tongue's surface. Pallor shows up here before it shows in the face or the inner eyelid in many people. This is worth mentioning specifically at your next blood test request. Ask for ferritin, stored iron, and B12 alongside a standard complete blood count, not just hemoglobin alone, because both can be borderline without the hemoglobin dropping enough to show as anemia yet. Sign 2. Bright red, smooth, almost shiny. This one looks like the opposite of pallor, but points to a similar cause. A tongue that is unusually red, like a deep beefy red rather than normal pink, and smooth or almost polished rather than having the normal textured surface, is describing a condition called atrophic glossitis. Your tongue normally has tiny bumps on its surface called papillae. These give it texture and house most of your taste buds. When B12 or folate levels fall, the papillae gradually wear away, leaving a smooth, glossy surface. The deep red color comes from the underlying tissue, becoming visible without the papillae buffering it. Research in Blood in the New England Journal of Medicine identifies this tongue presentation as a classic and often early sign of B12 or folate deficiency, frequently appearing before neurological symptoms develop. If this describes your tongue, ask your doctor for a B12 and folate level alongside a standard blood panel at your next visit. Sign 3. A thick white coating that doesn't come off with brushing. A thin white coating on the tongue is normal and varies with hydration, diet, and time of day. What's different is a thick, patchy, white coating that has a slightly raised or cottage cheese-like texture, and that doesn't clear with brushing or rinsing. This is oral candidiasis, a fungal overgrowth, and it is significantly more common in adults over 60 than most people realize. The reason it becomes more common after 60 is a combination of factors. Dry mouth from medications, reduced immune function, dentures or partial plates that create warm enclosed surfaces, and elevated blood sugar from prediabetes or diabetes all create conditions where candida, which is present in everyone's mouth normally, overgrows its usual boundaries. Research published in Oral Diseases found that oral candidiasis affects a significant proportion of older adults and is frequently underreported because it's assumed to be a minor nuisance rather than a flag for the underlying condition, making it possible. If this is what you're seeing, mention it specifically and ask whether your blood sugar has been checked recently. Sign 4. Scalloped edges, indentations along the sides from your teeth. Look at the sides of your tongue, the edges on both the left and right sides. Healthy tongue edges are smooth. Scalloped edges have a series of indentations, sometimes quite pronounced, that match the position of the back teeth. These impressions form when the tongue is slightly larger than it should be and presses outward against the teeth, particularly during sleep when the tongue relaxes fully. There are two main reasons the tongue swells enough to do this. The first is hypothyroidism, an underactive thyroid, which is associated with a phenomenon called macroglossia, where the tongue gradually enlarges. The second is obstructive sleep apnea, where the tongue falls backward and partially obstructs the airway during sleep, and the resulting pressure and muscular compensation over months and years leaves the scalloping pattern. Research published in the Journal of Clinical Endocrinology and in Sleep Medicine both identify scalloped tongue edges as a visible correlate of these two conditions. If you've been told your thyroid is fine, but the scalloping is new and pronounced, it's worth asking for a full thyroid panel, including TSH, T3, and T4, rather than TSH alone. Sign 5. A yellow coating. A yellowish tint to the tongue's coating, distinctly yellow rather than white or gray, can indicate that your liver or gallbladder is under stress. The same process that causes jaundice in the skin and eyes, bile and bilirubin not clearing efficiently, can show up first or most obviously in the tongue coating, where the surface area and moisture make pigment changes more visible than in skin. This doesn't mean a yellow tongue equals liver disease. Dehydration, certain foods, and even some medications can produce a temporary yellow tinge. But a persistent yellow coating, one that's there consistently in the morning and doesn't clear through the day, is worth mentioning to a doctor alongside any other signs, fatigue, changes in urine color, or reduced appetite that might form a pattern. Sign 6. Smooth patches with irregular reddish borders that seem to move over days. This one looks alarming, but is usually not. Smooth red patches with whitish or raised borders on the tongue surface that change shape and position over days or weeks describe what's called geographic tongue. The name comes from how the patches look like the outlines of continents on a map. Geographic tongue is not dangerous and doesn't become something serious on its own. But it is associated with inflammatory conditions, including psoriasis, and in some people flares alongside stress or nutritional deficiencies. Its main value on this list is contrast. It's the sign that, once identified, can be set aside as benign, which makes it easier to distinguish from sign 5 or from the white coating of sign 3. If what you're seeing is shifting smooth red patches with borders rather than a fixed coating or fixed discoloration, this is the most likely explanation. Sign 7. A purple or distinctly bluish tinge to the tongue. The tongue should be pink. A tongue that has a purple or bluish undertone, not just in low light but consistently, is showing you that the tissue is not receiving adequate oxygenated blood. The same mechanism that makes lips or fingernails look bluish in cold weather or in cardiovascular stress shows up prominently in the tongue because of how richly supplied it is with blood vessels. A purplish tinge can indicate poor cardiac output, chronic lung conditions reducing oxygen delivery, or significant peripheral circulatory problems. It can also appear in people on certain blood pressure medications as a harmless side effect. If the color is new, persistent, and not explained by medication, it's worth raising at a doctor's appointment specifically as a color change in the tongue rather than a vague mention of tiredness or breathlessness, which is usually what the underlying condition produces as its main complaint. Sign 8. Trembles or pulls noticeably to one side when you stick it straight out. This is the most important one on the list to check carefully. Extend your tongue straight out in front of you and hold it there for 5 seconds. It should stay roughly straight with perhaps a very slight natural drift. A distinct pull or deviation to one side, where the tongue reliably angles toward the left or the right rather than extending forward, indicates weakness in the muscles on one side, which are controlled by the hypoglossal nerve on each side of the brain. Unilateral hypoglossal nerve involvement can indicate a range of things from a benign local issue to a sign of stroke damage or an active neurological process. Similarly, a sustained tremor or fasciculation, a rippling movement across the surface, can indicate neurological changes worth assessing. If your tongue consistently deviates to one side when extended, and this is new, meaning something that wasn't there a year ago, this is the sign on this list that warrants the most prompt follow-up, described specifically as tongue deviation on extension rather than as a general concern. What to do with what you found? If you found nothing unusual, that's useful information too. Take a photo of your tongue right now in good natural light and save it with today's date. Most changes on this list happen gradually, which means they're easiest to catch by comparison over time, rather than in a single look. If you found something, describe it specifically at your next appointment, rather than generally. Not my tongue looks a bit off, but the coating is thick and white and doesn't come off with brushing, or the edges have pronounced indentations from my teeth, or the surface has lost its texture and is smooth and bright red. Specific descriptions produce specific investigations. Vague descriptions tend to get noted and left. The tests most relevant to what's on this list, depending on what you found, are a full blood count with ferritin and B12, a full thyroid panel including T3 and T4, not just TSH, and a fasting and post-meal blood glucose, or HbA1c. All of these are standard tests. None of them require a specialist referral to order. 3 things before tonight is over. Do the tongue check right now in good light, ideally natural daylight or a bright lamp rather than bathroom fluorescent light. Look at the color, the coating, the edges, and then extend it straight and hold for 5 seconds. Take a photo in good light and save it dated. This one is worth repeating in a month to compare. Write down anything from the 8 signs that matched, using the specific language from this video, and put that description in your phone for your next appointment. Write in the comments which number matched when you checked, and whether you're going to mention it to a doctor, your age, and where you're watching from alongside. If this video reaches someone who catches something early because of sign 4 or sign 7, that's the whole point of making it.